All right, let's talk about artificial intelligence in medicine. We're constantly hearing these incredible stories about AI diagnosing diseases better than humans or predicting patient outcomes with, almost superhuman accuracy. But what if the biggest challenge isn't just building a smarter AI? What if it's figuring out how we as humans are actually supposed to work with these things? Today, we are diving into a really fascinating idea for a brand new medical specialty, one that's designed to solve that exact problem. So let's start with the big promise, the one we've all been hearing for years. The core idea is that these incredibly powerful algorithms are going to enhance a doctor's own skills, leading to faster, more accurate decisions. It sounds simple, right? You give a great doctor a great tool, and they naturally become an even better doctor. But is that really what's happening out in the real world? Well, here's the twist. A really important study took a look at surgeons who were consistently underperforming in AI when it came to predicting post-surgical complications. So they gave these surgeons the AI's predictions and said, okay, now update your own guess. The result? A 0% improvement. That's right, nothing. Having access to this smarter tool didn't make their own predictions any better at all. So what is going on here? It turns out that study wasn't just a fluke. There's actually a lot of evidence showing that when you just hand these super sophisticated AI tools over to physicians, it doesn't automatically improve their decision-making. That revolution we were all promised, it seems to be stalled right at the starting line. And this really gets to the heart of the problem. It doesn't matter if you're talking about surgeons or doctors using the latest large language models or LLMs for diagnosis. The pattern holds true. The AI on its own does great, but when a doctor uses it, their performance barely moves the needle. We're essentially asking doctors to become instant experts on a technology they've had almost no training in. Now, the immediate reaction is probably, we'll just train them better, or maybe, let's make the AI more transparent so doctors can see how it's thinking. And look, those are logical ideas, but as we're about to see, the problem runs a whole lot deeper than just a simple training gap. This slide really breaks down why those simple fixes just don't cut it. On the one hand, sure, more training would help, but it's just not realistic to expect every single physician to master the unique quirks and limitations of dozens of different AI models. Then you have explainability, things like heat maps that show you what the AI was looking at. But that doesn't really work either, because doctors aren't trained to interpret that kind of data, and a static picture can't possibly capture the nuances of an individual patient. This quote from the research just nails the problem perfectly. Think about it. We would never expect a family doctor to look at the raw, unprocessed data coming out of an MRI machine and make a diagnosis. That's a radiologist's job. They are the trained specialist translators for that complex technology. And yet, that's exactly what we're asking doctors to do with clinical AI right now. So what this all points to is a massive hole in the system. The issue isn't that we need a better tool or even a better doctor. The problem is the missing link between them. So what does that link look like? Well, the proposed solution is actually both incredibly simple and really, really smart. Instead of another piece of software, the solution being proposed is a new kind of expert, the Algorithmic Consultant. And we're not just talking about a new training course here. We're talking about an entirely new medical specialty, created specifically to manage the relationship between practicing doctors and clinical AI. So who is this person? You can think of them as the human interface for clinical AI. This is a physician who also has deep, specialized training in data science. Their entire job is to translate the powerful, but often confusing, output of an AI model into practical, safe, and actually useful advice for the doctor who's treating the patient. And here it is. This is the aha moment that makes the whole idea click. This isn't some crazy new concept. It's actually an evolution of a role that's already absolutely essential in every hospital, the clinical pharmacist. A pharmacist doesn't just hand out pills. They manage the hospital's entire complex ecosystem of drugs, advising doctors on which one to use, when to use it, and what the right dose is. The algorithmic consultant would do the exact same thing, but for AI models. Okay, so what would this specialist actually be doing day to day? Well, their job would basically break down into two main areas, and it perfectly mirrors the work that their pharmacist colleagues already do. So on one hand, you have their work at the point of care, where they're giving direct, real-time advice on specific patient cases. And on the other hand, they're responsible for the big picture, the system-wide governance, managing the entire suite of AI tools that a hospital uses. So let's picture it. At the bedside, or maybe more realistically, over the phone, they are the translator. A doctor has a really complex case and thinks an AI could help. They call up the algorithmic consultant. That consultant then helps them pick the right model, helps them interpret the output, and most importantly, helps them understand the model's blind spots, making sure the AI's advice is tailored perfectly to that one specific patient. Then, at the institutional level, they are the gatekeepers. Just like a hospital has a committee that decides which drugs it will stock and approve for use, these consultants would vet, approve, and continuously monitor every single AI tool. This kind of oversight is what would prevent total disasters, like an AI transcription tool just making up parts of a patient's medical record, by making sure only safe and validated models ever get used. Now, let's be realistic. Creating an entirely new medical specialty is a massive undertaking. So it's totally fair to ask, is it actually worth it? We need to talk about the return on investment here, and it goes way beyond just dollars and cents. Of course, you're going to have some direct financial benefits, like picking more efficient or cost-effective tools. But the real value, just as we see with clinical pharmacists, is in the indirect benefits. We're talking about reducing medical errors, improving patient outcomes, and, this is the big one, mitigating risk. This specialist fundamentally de-risks the entire scary process of AI adoption for both the doctor and the hospital system. So really, when you boil it all down, this was never about replacing doctors with AI. It's about finally recognizing that for AI to be truly effective and safe, our doctors need a new kind of expert collaborator to help them navigate this incredibly powerful and complex new world. This role just makes AI better and safer for absolutely everyone involved. As we move deeper into this new era of what you might call algorithmic medicine, this research suggests that the most important question isn't just how good is our AI, the real question is how smart are we about integrating it into the real world of taking care of patients? Because creating a human specialist to manage our artificial ones might just be the smartest move we could possibly make. Thanks for tuning in.